Hello. In this training video, we will be covering additional patient information. You can find additional patient information sources on the left-hand column of the patient's dashboard. We're going to start out with interview history. The interview history allows you to see the list of interviews that have been taken by the patient within their PHR portal. You can print out these interviews by clicking the print icon on the far right. You can see the status of those interviews. You can also see if the interviews were assigned to an encounter and when the date of the appointment was, along with their interview date. The next section is the pharmacy section. The pharmacy section allows you to compile a list of the preferred pharmacies of the patient. You can add a pharmacy by clicking the plus button in the upper right corner. It will load a list of active pharmacies in your system, and it will add it to their file. If the patient no longer uses this pharmacy, it's not preferred, simply click the X button on the far right to deactivate it. The next section is the Preferences section. Within the Preferences section, we can include specific scheduling and communication preferences for the patient. On the left-hand side, you can set your day and time preferences for the patient. For example, you can set the date that they prefer to be seen, as well as the time range that they want to be seen within. You can also set their scheduling risk. This is used to indicate if the patient is a low risk for canceling appointments or a high risk for canceling and/or no-shows. This is where you can also take away or allow the patient to schedule via the PHR portal. For example, if the patient has made many appointments via the PHR but does not show up for any of them, you can remove the ability to schedule via the PHR portal. The next section we're going to go over is the Referrals section. The Referral section allows you to add or retain information about referrals to external sources. For example, if the patient has to go see a specialist for a specific diagnosis or treatment, you can use this section here to document that you referred them to the external provider. To add a referral, click the plus button in the upper right corner. Here you can fill in the information that pertains to this referral out, such as the referral to, the source where this referral information is going, the reason for their visit, if they're going to be seen, if you were able to book an appointment, general comments. Once you have clicked the Add button, you open up a couple other sections. You can now generate a transition of care document, and you can also add any response information such as response date, response comments, upload or scan any documents in reply to that response. We're going to click Save again, and it's going to pop us back to our listing. This is the current active listing of all of the patient's referrals to external providers. You can choose to click the inactive bubble at the top to see anything that's inactive, or all to see all of them together in one listing. To remove a referral, click on the red X button on the right-hand side. This will pop it to the inactive status, showing that it was once part of the system, but that it is no longer. It is in the inactive status. This concludes our training video on additional patient information sections. Please remember to use our knowledge base and contact us for any additional assistance. Thank you.